Hi, we're broadcasting live from our Greenfield Clinic. My name is Corey Johnson. I work on the social media team here at Children's Hospital of Wisconsin. And today I'm joined by Dr. Kevin Walter. And today we are going to be talking about what parents need to know about concussions in young athletes. Now, concussions are a widely recognized sports injury, but they are often more common and sometimes potentially more serious than people think. And if not managed properly, a concussion injury can have long-lasting complications in a child. So, is your child ready to play? Do you know the signs and symptoms of a concussion? Well, we're going to talk about all that and more during today's discussion with Dr. Walter, but we also want to hear from you. So if you could please go ahead and post your questions about concussions in the comments section of this video. We'll go ahead and answer as many of those as we can during today's live broadcast. So with that, I'd like to introduce you to Dr. Kevin Walter. Dr. Walter, to begin with, can you introduce yourself, tell us about your role in the sports medicine program?
Yes, so I'm Kevin Walter. I am a pediatric primary care sports medicine physician. That means I don't do any surgeries. Okay. But here at Children's, our sports medicine program takes care of musculoskeletal injuries and also concussion. And we take care of kids that just get hurt in the backyard to the level of athlete, Olympic, professional, collegiate level athletes too. And primarily we see college age and younger here in clinic.
So for those who don't know, can you describe what is a concussion injury? What does that mean?
So a concussion technically is called a mild traumatic brain injury. And the way that I describe it to most people is it's not bleeding, it's not bruising, it's not brain damage. But what happens is you get an impact to your head, usually, and your brain shakes inside your skull. And then it throws off how the nerves of your brain use energy. They do a bad job using energy, which makes you function slowly, it makes you remember and process slowly, and it makes you feel bad. So that's your injury. Now, it's a temporary injury that goes away over time. And the trouble with concussion is you can't predict from the injury, is this going to be a concussion that lasts 2 days or 2 weeks
so there
or 2
are
months.
Mild concussions and more serious concussions? There are different levels of it?
Not really. It's hard because, for say, if you were knocked out, let's say you get a concussion, you get knocked out, loss of consciousness, you have a seizure, you have terrible headaches, and all of those symptoms go away within 48 hours. That's a horribly scary presentation. But you resolve really quickly. Versus somebody who is playing basketball, they take an elbow to the head, they feel dizzy, they feel headachy, but the symptoms last for 6 months. Which one of those is mild, which one of those is severe? So I tend to avoid all that and just say a concussion is a concussion. And we can go back and look at every injury when you've totally recovered to say, geez, if this didn't last very long compared to if this one lasted longer, which one makes me more nervous? Which one do we need to follow? Because the truth is usually that one concussion is not going to cause a lifetime of problems. It's that multiple injuries can cause trouble, but there's no direct number of, is it 3, 4, 5, 6, 7, how many is too many?
So if a parent were asking you, is a concussion dangerous? I mean, there are many layers to that. Well, on itself, yes, it can be dangerous, and then maybe if you get a lot of them, it's even more dangerous to your body.
Yeah. So I would argue that, is a concussion dangerous? Yes. Because it's not, because it's a head injury, it's a brain injury. So it's something serious that needs to be taken seriously. Now, if you identify it and treat it appropriately, I expect full recovery. And I expect no prolonged problems.
As a medical professional, have we come to that realization more in today's medicine than we did maybe 15 or 20 years ago? Like back in the day, did they just kind of take the hit in the head and move on?
Correct.
Right?
Yeah. I mean, so 20 years ago, it was a totally different animal. It was, oh, you got a concussion? No big deal. Keep playing. You got headaches. Forget about it. And now we recognize that when things go wrong with concussion, they can go really wrong. And to me, the key thing on the sideline is not, yes, it's do you have a concussion or not. And once we think you might have a concussion, you should not go back into play until you're fully recovered and medically cleared. But the real thing is, do you have more than a concussion? Could you have a skull fracture? Could you have a brain bleed? So those things that are going to lead to, immediate kind of life-threatening problems, we need to be able to identify those right away. If they're on the sideline, then get you into the ER where there's medical staff that can treat that in case things go poorly, and not have you getting worse on the sideline. If you have a concussion and you don't have the bleeds, then we can take a breath, because you will get better. It will just take time and support along the way. But if you have a brain bleed, we got to figure it out right away.
Yeah, so what does that treatment look like for, I don't know if there's a more common type of concussion or a more frequent patient visit that you see. What does that look like for a family who comes in with a child who may have a concussion?
Well, let's start with concussion and what does it feel like?
Right.
So really with concussion, what you're looking for is there was a trauma. And again, most people get hit in the head, but you can also get hit in the chest, and that whiplash force can go through and shake your brain. But you're going to have that trauma, and immediately afterwards or shortly afterwards, you're going to have symptoms of headache, feeling off, dizziness, nausea, things along those lines. So you'll get the story of, I hit my head, and after that I felt different. I saw stars, I blacked out, I did this. And that's really when those people need to be taken off the field of play, not allowed to return, medically evaluated.
And is it the coaches and the parents? They should know this. They should know what to ask. Is that part of the education we need to provide?
I think so. I think if you ask a young athlete, I mean, if you ask any athlete, hey, how are you feeling? Hey, I just saw, Corey, you were playing football, you took a big hit. How you feeling? You're going to say, I'm fine, right? Because you just want to play, you don't really care. So what we've noticed more is with more concussion education and awareness, yes, I want athletes, teammates, coaches, parents to all be aware of what a concussion is. I don't expect them to diagnose it. But I expect them to be aware that this is an injury, here's the signs and symptoms. If they think it could be happening, this could be a concussion, they need to get the kid off the field of play and not let them back in. You know, when in doubt, hold them out, better safe than sorry, all those little catch lines. And what we've noticed is with this increasing education, we've got more athletes coming forward and being honest about symptoms and reporting it. We've also got more teammates saying, you know, when I walk back to the huddle, Corey was supposed to be playing here as linebacker, and he was lining up on the wrong side. Something's not right with him. And so we have teammates reporting to coaches and then pulling them off too. Because the problem with concussion is, one, it's self-reported, so athletes may not want to report because they don't want to be held out. Two, they may not remember the injury because you can get amnesia with the concussion, or they may not be aware that they're concussed because their brain is so dysfunctional. So after those hits, it's keeping an eye and seeing how they act and are they going to the right places, talking with them, interacting with them, and asking them more than how do you feel? Because how do you feel is fine, but do you have a headache? Do you feel dizzy? Where are you supposed to go? When you start digging in deeper, the coaches and the parents who know this athlete will recognize, well, hey, maybe you're not acting right. You're not answering the way I would expect. And that's a big enough red flag to say, stop, you may have a concussion. We need to get you off the field of play and get you evaluated.
Looks like we have some questions from our Facebook fans.
We do. We got two in, but I think we're going to answer this one first because it kind of pertains to this topic. For example, a wrestler since it's such a rough sport, could there be a concussion without any signs?
So one of the problems with concussion is a smaller percentage of people will get a concussion and not develop symptoms right away. It may take half hour, 2 hours, 3 hours to develop those symptoms. Now the big question is always, did they just get the injury, have low-level symptoms, and the athlete's not reporting it? Or do they really not get symptoms until later? So that's one of the confusing things with concussion. It could happen, but the vast majority, the athlete feels it and knows something is wrong.
So sometimes it might not be obvious right away. It may take a few minutes or even a few hours to...
Yes.
Okay.
Yeah.
All right.
Great, thank you.
And unlike, you were saying obvious, unlike a broken leg where you can look down and say, oh my gosh, your leg looks terrible. With concussion, we look like we do right now. So physically you look the same. Mentally, you don't feel the same.
I think there have been a lot of headlines in the news about maybe football and concussions, but is this a risk that applies to a lot of sports? And what type of sports injuries do you see related to concussions? What sports, I guess?
Every sport.
Really?
So I've even seen it in golf.
Really?
You know, you can get it by a club or a ball, but the reality is football's number one because it's a contact collision sport. So when you have that body-to-body contact, you're at risk for concussion. So when you look at girls, the top 2 female sports are soccer and ice hockey. Even though technically at the high school level, girls ice hockey is non-contact. Unlike boys that allows checking, girls are no checking, but it's still, there's collision and contact on the ice with bodies, with board, with equipment, etc. So any sport carries that risk. Baseball and softball carries the risk. It's something people don't think, oh, that's not a high risk. Yeah, it's a moderate level risk. Basketball, soccer, wrestling, lacrosse, rugby, those are kind of the higher level ones.
So what do you tell parents who are considering having their kids participate in some of these sports as a teen or as a young athlete when they ask you about the risks of concussions, and is it worth it? Are the risks too dangerous for my child to play football, for example?
I love sport, and that's kind of what drew me to sports medicine because, and it sounds cliche, but I really think we learn life lessons from sport. You know, I would rather have people playing sport and being active and healthy than sitting around gaming all day. We know in our country and around the world there's an obesity epidemic. If we are deterring kids from sports, we're contributing to that problem. So I think sport done safely is very appropriate, and I would encourage it. Any sport, you know, you learn to win, you learn to lose, you learn to be a teammate. You learn all these things that are going to serve you for the rest of your life in business, in relationships, in academics. So I strongly encourage all sports if the kid wants to play.
And then if I'm a parent and I'm going to have my child engage in some of these sports, should if my child have a baseline concussion test? And what is that? And when do kids get that?
Yeah. So concussion testing, you'll hear a lot about baseline testing and computerized testing. So the NFL does computerized testing, and it's the main computer test out there is Impact. Here in our program, we use Impact and one called Cogstate. Their goal is to measure how your brain is functioning, processing, remembering, reaction time. So with a baseline, think of it more as a pre-injury test. So we have the athlete come and sit, take this test on a computer. It takes about 30 minutes. And then we get some numbers, some objective data about how their brain is working with the thought that after a concussion, when the athlete says that they're all better and they want to get back to sport, we can retest them to make sure that those numbers come back up to the same level. Because if they're not up to the same level, then we wonder, well, have you fully recovered?
And we want them to return to play, right? And so
Correct.
The baseline test is one tool, or is it?
It's a tool.
It's
a tool. Yes. So baseline tests and a lot of these computer tests are used, in my opinion, kind of erroneously or wrongly. They're not there to diagnose concussion. They're not there to make the final decision on return to play. They are there to help us along the way. Because as we said, athletes can lie. And there's some studies out there that 30% of athletes lie about their concussion, which means every time I walk into a concussion room, I'm trying to figure out, are you being honest or not? And the risk of not being honest and going back too quickly is that you're incompletely recovered, therefore you're at higher risk for another injury.
So on that point, so if I were to go back to my sport too early, I would be at a higher risk for either another injury or another concussion?
Another concussion.
Which makes everything worse again.
Yes, and even worse than that. So the concussion on top of the concussion is where we see second impact syndrome in younger athletes, which is brain swelling, bleeding. That leads to brain damage, that leads to death.
So
now it's rare, but it happens.
Path.
Yes.
Okay.
And then you're in concussions happening close together, and concussion on top of concussion can lead to very much prolonged recoveries. We're talking, instead of days to weeks, months recovery.
And this is not then just impacting their level of sport that they play, but also probably how they're performing at school, right?
Everyday life.
Everyday life.
mean, because if your brain is not working right, you're going to feel bad, you're going to struggle with school, you won't be able to keep up with grades and homework, you're going to struggle hanging out with friends, you're going to get in more arguments with family, you're not going to be able to do the things that you like to do in addition to sport. So concussion really affects all of life. Which is why ignoring it, I think, is a bad idea, because it's going to come out and it's going to cause problems somewhere. And unfortunately, at the young athlete level, a lot of times that somewhere is negative impact with school, which is tough. But if you get in and treat it, we can work with the schools here in our program. We've got a really robust kind of return to learn program where we provide notes to help adjust and accommodate learning So athletes can stay at school, can continue to learn, can keep their grades at the appropriate level, and can recover, and we don't overwhelm or overburden them.
That's interesting. Looks like we have another question from our Facebook fans.
We do. A question came in from Larry. Is it necessary to ever repeat a baseline concussion test? For example, if one was done at age 12, should they be doing another one in high school?
Yes. So when you look at baseline testing, so this brings up another great point too that I'm going to jump to before I answer the question. So we talked about the computer baseline test. Now here at our program, we found that through our research arm at the medical college and Dr. Michael McRae, we know that a multidisciplinary approach and a multi-pronged approach is probably the best way to deal with concussion. So in addition to computerized testing, we also do baseline balance testing, because balance can be thrown off with concussion. And we also do a thing called the King-Devick test, which is eye movement testing. And we can see a lot of that dysfunction with concussion too. So we use those three things for our baseline, because you may be able to pass one, but if you're still concussed, the odds of you passing all three are pretty low. And so when do you need to repeat these? Because you absolutely do. At the age of 12, you're going to grow with balance, with coordination, with knowledge every year. So my push is we need to have repeat baseline tests probably on a yearly basis up until what I would say is probably the varsity level of high school, and then going every other year. So like collegiate athletes, I'll say you want an incoming freshman baseline test, and then you probably do another one junior year.
And as a pediatric sports medicine specialist, I mean, we recognize that these children are growing, right? They're changing over the course of their maybe high school sports career. Do you take that into consideration when you're looking at maybe a 12 or 13-year-old child versus a 17-year-old? Are they vastly different maybe when they come in with a concussion, or is it, how does that work, I guess?
I won't say vastly different, because they have very similar symptoms. You know, one of the challenges with concussion, everyone is different. So the way that you feel and get injured with a concussion will be different than me. And even if you've had your first one may feel like this, and your second one may feel like that. So even among an individual, concussions are going to feel different depending on what part of the brain is injured. And then as you grow, you know, a 10-year-old describing how they feel to you versus a 17-year-old is going to be very different. So just how they say the injury affects them, how they describe the symptoms, what you can see on exam, those things are going to be different based on age. And I think that's the luxury of being pediatric trained is I can walk into a room with a 4-year-old and feel very comfortable interacting with that 4-year-old. Then my next room can be 18 and feel very comfortable interacting with the 18-year-old, and then go to a 12-year-old and feel very comfortable interacting with them. As you get to know, hey, at this age level, this is what I expect. Here's the best way to interact with them, to get the story out of them, to kind of create that doctor-patient relationship that can be difficult when you're used to seeing all adults and then shift down to a 10-year-old.
Okay. We have some more questions through Facebook. Marianne asked, my son has had 4 concussions. Can that contribute to his learning ability? I think we touched a little bit on this before, but what do you have for somebody like Marianne who has that concern?
So there's research out there done at the professional athlete level for football. So NFL players, there's research showing that if you have had 3 concussions as an NFL player, that it may, not everyone, but some, may affect learning potential. So you may have some cognitive difficulties or decline. Now, the degree of that decline and effect is really variable, and who actually has it or not is really variable too. But that's a report that bears importance, because we know that more concussions is not better, and we know that in theory more concussions can increase your risk for that. Now, could 4 concussions affect learning and cause trouble? Potentially, yes. But it could totally not either. So to me, what it speaks to is the importance of every concussion being taken seriously and evaluated well, because what I look for is trends. If you're a person with 4 concussions and you've gotten them all from what I would say appropriate mechanisms, bigger hits and stuff like that, not like a soft tap or slap against the helmet, good play, and now I'm concussed. So if you've gotten them from a true mechanism of injury and they've all fully recovered and they lasted, less than a week, that's a person that I'm less worried about than someone who has gotten them from lesser forces, or the concussions are starting to last longer, weeks to months, or even more alarmingly, if they're not fully recovered. So again, the way I operate is if I have a worry that you're not fully recovered, if I have a worry that you're heading into the red zone of your concussions may really start to cause cognitive problems, I'm going to verbalize those and let families know, because at that point I would be worried about returning someone to a high-risk sport. But that's a really hard question because everybody's so different.
So as a parent, one might ask, is there something I can do to prevent a concussion? I'm sure the answer is no, but have you seen maybe a culture change or anything in high school sports or professional sports that are trying to prevent the likelihood of concussions or the frequency of concussions?
I'm smiling so much because culture change, because I love it, and we didn't prep that ahead of time. That's what it is. Yes, you're right. You cannot prevent concussion. Soccer headgear is a fabulous demonstration of that. There's soccer headgear that doesn't reduce concussion risk. Football helmets doesn't reduce concussion risk.
So you can't get a good enough helmet to remove a concussion risk?
At this point, no, but I applaud manufacturers for continuing to try. There may be something there, but right now we're just not reliably seeing it. So what it needs to be is that culture change. It's not, at this point to me, prevention. It's awareness and reporting. And the previous culture has been hide your injuries, man up, tough it out, don't say anything. And it's got to become, well, hey, injuries happen. If we identify them right away and we treat them effectively, you'll actually get back out there faster.
Do you think some of that
without problems?
Some of that starts with our professional sports figures that we look to as our idols and our role models, like helping us change the culture around this?
Of course, that would make life much easier. Yes, if the pro athletes would come out and I'll say, "Hey, we're going to do this." But even there, you look at some pro players that have a concussion that everyone expects to be back in a week, and then they say, "Hey, I'm still having symptoms. I'm not ready to play." And there's media reports and people that rag on them and get down on them. And, it's not fair. This is an athlete doing the right thing, and yet people are criticizing them and calling them into question, which is wrong. Now, we also know there's athletes that come out in the media and say, if I had a concussion, I'd pretend I had a foot injury and I wouldn't say anything about it. So yes, it would be great if the pro players stepped up and did the right thing. I don't think we can rely on that. So we start the culture change younger, because those guys were all brought up in the tough it out culture. So expecting them to change like that after, decades of being brought up in the don't talk about it is a tough thing. But I think if we start at the young athlete and the high school athlete and try and change the culture from youth going forward, we're going to get success. We're going to get awareness, and we're seeing that. We're seeing that in the research.
Good. Looks like we have some more questions from our Facebook fans.
Yeah, so one of the questions came through, and it was more about the recovery. So if you realize that you have a concussion, or your head's not feeling quite right, is there a certain amount of days where you should tough it out or something like that before you go and see a doctor? Or is it X amount of days before you should get professional help, or is that recommended right away? Or
I would say right away. The wrong answer is to tough it out or continue to play. So if you think you might have a concussion, so you got hit in the head and now you have a little bit of a headache, the answer is report it right away, get off the field to play. If that headache sticks around, if it's gone by the end of practice and then you go back to school tomorrow and it's totally fine, hey, odds are that's not a concussion. I think it's always worth checking in with your primary care doc. If you're at a school or if your club has an athletic trainer, by all means, always touch base with the athletic trainer, because it's not always going to be concussion. But if it's something that lasts for a few days, you've got to get in and get evaluated, because having a headache that lasts for multiple days is not a normal thing, especially after a trauma in sport. That's concussion.
All right, and then another one. How can a child get a baseline concussion test?
Yeah. So I'll do a little advertisement for us. So depending on what community you live in, if you live here, you can call our concussion program, and that's 414-337-8000, and that gets you into the scheduling folks, and they will, if you say, I want a baseline test, they'll help you get that set up and scheduled. If you don't live in this area and you're somewhere else, touch base with your school or your sports club or your primary care physician, because usually they're going to be aware of who offers it. You know, some of our schools have baseline testing. They usually do more of the computer stuff and not the robust testing that we do, but that's often free if you're participating in sports.
Great, thank you. And then the last question, what signs should I look for as I get older from a concussion? So I think maybe they had a concussion. Is there anything they should watch out for in the future?
No. I mean, as long as you've taken care of. So one of the big fears that I get all the time coming through clinic is my child going to have chronic traumatic encephalopathy, CTE, which is what we're starting to see with a lot of the old NFL players. And the truth of the matter is, we don't really know why that happens or the pathway from injury to CTE. Realistically, it's more than just concussion. It's the number of concussions you've had, it's how you've managed them, but also it's the number of repetitive non-concussion head impacts over time, which is why the professional athletes that do it day in and day out seem to have more problems than people who are just high school athletes. My expectation is that when you have a concussion, that you have fully recovered, and then concussion doesn't come back. So it's not like I'm going to pick on you again, if Corey got a concussion playing spring soccer and we kept him out and he treated it and did the right thing, and by July 4th he was back to normal, and then getting back to normal, we said, okay, Corey, you're going to start reading over the summer. We're going to stepwise build you up with exercise and activity if that goes well. And then Corey's mom calls me up in September saying, hey, Corey's struggling with school. I think his concussion's back. It doesn't work that way. Right. So once concussion is gone, we've built you back to full speed. It doesn't come back. I don't expect return of headaches. I don't expect return of academic problems without another injury.
Okay. One more question I have here from Carrie on Facebook. She asked, what are your thoughts on a child with a non-convulsive seizures playing football? Is there an increased risk for making their seizures worse from a hit to the head or concussion? And I kind of read more into her question about maybe pre-existing injuries or things going on with a child's physical ability. Does that mean a concussion may be more or less likely to happen?
That is actually a great question. So when you look at sport, so we're going to break this down into two things, sport and chronic illness or chronic problem. Athletics and exercise is basically beneficial for almost all of the chronic illnesses and problems. So when you look at seizure, people get worried because should I allow my son to play any sports or football if they have a seizure disorder? And my answer is, number one, you've got to be cleared by your neurologist. But usually what the neurologist will look like, if you have a well-controlled seizure disorder, you can play whatever sport you want. Scuba diving is the one thing that I would say no, but it's not like we have high school scuba teams. But getting back into football and stuff like that would be great, and I would encourage it because we want people with seizure disorders to be healthy and active. We don't want that seizure disorder to take them out of life.
And again, we want kids to play. We want them to be engaged in sports. That's what we want.
Absolutely.
It looks like we have another question from our fans.
Yeah, so tennis isn't considered a high-impact sport, and you had talked about concussions and getting a baseline test for high-impact sports. It is important still to get a baseline test if you're playing any sport, is that correct?
It can be helpful because you could be a tennis player and you could slip on the ice in the winter, or you could be a tennis player but also a skier and crash skiing. So having that baseline information is helpful for managing those injuries that come from other places in everyday life. The reality is, are you going to get a concussion in tennis? You could, but it would be pretty unusual. So having it can be helpful, but I wouldn't say it's as important as it is for, say, lacrosse or rugby.
Okay. I have a question here from Ronnie who asks, what percentage of kids do you think are diagnosed with concussion also sustain whiplash-like injuries, and do you foresee massage being incorporated along with PT/OT as standard treatment for recovery?
So with concussion, not everyone has other problems. Sometimes, and I'll say just concussion, like it's not a big deal. Sometimes it can be just concussion, but there's other people with concussion, if they get hit hard enough, their neck cranks and they get a whiplash injury, which is basically the back part of your neck, the muscles can kind of spasm out. And so if we see that, we know that that's associated with a prolonged recovery, chronic headache, so we treat that through physical therapy, through massage. You can also get eye movement problems, you can get TMJ problems, so any other thing that may come along with concussion, here at our program, we're really aggressive with treating those other things to make sure that everything goes away and improves back to normal.
That's great. Well, we've covered a lot during today's broadcast. Any final thoughts, anything that we didn't cover that you think parents should know about concussions?
Yes,
Okay.
I think that, again, be aware of signs and symptoms, and on our website, we have those listed.
So you go to chw.org, okay?
And those will be there.
All right.
Make sure your kids are aware, make sure your coaches are aware. It's okay to ask coaches questions. What would they do if your child has a concussion? Make sure that you're comfortable with the coach's response, because if you're not, you've got to get yourself there. Their coaches are like second parents. And then the other thing I would encourage is always report the injury and seek out treatment. Never hide concussion. Hiding concussion leads to problems and complications. Reporting it and regular treatment gets you better faster, and we will get you back out there. And again, it's getting you back out there to play, but doing it in a way that is safe and doesn't compromise any long-term learning, functionality, anything like that.
Well, thank you very much for your time. And if you'd like to learn more about our sports medicine program, our baseline concussion testing, or any of our concussion care, you can visit chw.org. Dr. Walter, thank you so much.
Thank
you all for joining us.